The SecuTec Genu from Bauerfeind is a functional orthosis for stabilizing the knee joint. The anatomically contoured, high-strength aluminum frame is exceptionally light and offers excellent wearing comfort. The orthosis hinge restricts the range of movement of the knee joint in line with therapeutic requirements. The SecuTec Genu is available in 6 standard sizes and can be individually adjusted to fit the patient's leg. The following parts are included in delivery: the knee orthosis with condylar pads of varying thickness, the strap with strap pads, 2 shell inner pads, 2 spare condylar pads, and 2 pressure relief pads. These can be affixed to the lower medial shell frame if required to relieve pressure on the edge of the shin. A Torx wrench and block system for individually adjusting the angle of flexion and extension. The following tools are required: a tape measure, a knee goniometer, and a rounded contouring device. During the diagnosis, the affected knee is thoroughly examined following a consultation with the patient to identify any possible circulatory problems, allergies, or skin irritation. Measurements are preferably taken with the patient in a standing position. For the measurements, the patient bends his knee at a 30-degree angle. The correct angle of flexion is checked using the knee goniometer. During the palpation examination, the knee joint cavity is palpated on the side. The cavity is located approximately at the level of the top of the patella. From this point, use a tape measure to measure 17 centimeters upward and 15 centimeters downward. Measure the circumference of the leg at these 2 points. Following the same principle as any other knee orthosis, the SecuTec Genu is positioned with its hinge pivot axis in line with Nietert's compromise pivot axis. The patient's leg is bent at a 30-degree angle. The goniometer is used to check the angle of flexion. Palpate the top of the patella with the thumb. It should be possible to feel a small hollow in the middle at this point. Follow the knee joint cavity further in a medial direction and mark it with a line. A second transverse plane is marked out 19 millimeters above this line. Measure the distance from the hollow of the knee to the patella using 2 goniometers. Divide this distance into 2 sections covering 60 and 40% of the distance respectively from the front in a dorsal direction. The calculated value corresponds to Nietert's compromise pivot axis. Mark this point. The mechanical pivot axis of the orthosis will be positioned precisely on this anatomical pivot axis later on. Only by doing this is it possible to provide treatment with the 2 pivot axes optimally aligned, thus avoiding any constraining forces on the knee ligaments. The first fitting of the SecuTec Genu. To check the fit of the hard frame, leave the straps open to begin with. Important: the pivot axis of the orthosis must be aligned with the pivot axis of the knee joint. The lengths of the straps can then be adjusted. Check the fit. To avoid the risk of an anterior drawer effect, the positioning of the pad is checked with the knee bent at a 30-degree angle, and the securing strap is tightened by hand. To allow the orthotist to individually adjust the orthosis, loosen the straps and take off the orthosis from the front. Take the Velcro straps out of the guide slots. The shell pad is removed. The hard frame is adapted to fit the shape of the leg using a rounded contouring device. Reassemble the orthosis completely before fitting it again. To adjust range of extension and flexion, remove the 2 screws from the hinge cover. The hinge stops are also detached in the process. Remove these and replace them with the relevant extension and flexion stops from the system. Reattach the hinge protection cover and tighten it by hand. The range of movement of the knee joint is now precisely limited and ready for therapy. The orthosis is always put on the knee from the front. When putting on the orthosis, the leg should be slightly bent at approximately 30 degrees. Check the alignment of the 2 hinge pivot axes with the compromise pivot axis. The SecuTec Genu fits perfectly. Thread all of the straps into the guide loops. Start fastening the straps on the lower leg. Take the ends of the straps and pull them evenly to close them. Then fasten the straps on the upper leg. It is recommended that you check the fit of the orthosis within 30 minutes after putting it on. You can tell that SecuTec Genu fits correctly if constant pressure can be felt when the muscles are tensed. The patient needs approximately 3 to 5 days to get used to the orthosis. The SecuTec Genu can be worn almost imperceptibly under clothing. The pads on the skin are breathable and have a non-slip coating. The knee joint is securely guided and optimally stabilized.